Across the state, first responders are coming face to face with the coronavirus. Many firefighters, EMS workers, and police officers have been quarantined, and some have contracted the virus. Bob Zaltsberg reports on the extra precautions departments are taking to try and protect themselves and ensure their units stay fully staffed during the virus pandemic.
Indiana State Police Public Information Officer Kurt Durnall says police officers couldn't avoid working with people even if they wanted to.
We're always going to have interaction with people. That's what we do, whether it's out on the street, whether it's right here at our facilities. Folks are going to come in and we're going to have interaction with them.
Knowing that, the Indiana State Police has policies in place to be ready to address all communicable diseases, not just COVID-19. They also have tools.
The rubber gloves, the respirators, the masks, the whole outfit that we put on to help guard against anything.
He says state troopers and other police officers undergo regular training so they can be ready to deal with what comes up.
We're training continuously, no matter what the scenario is, no matter if there's some type of virus that's making news waves. We're always training and preparing for that instance that it might happen, and it might save our lives, it might save your life. So that's what we're training for right now.
Both Durnall and Bloomington Fire Chief Jason Moore say their departments get regular updates from numerous agencies concerned about safety. For instance, Moore gets tips from the Monroe County Department of Health, Indiana Homeland Security, and the International Association of Fire Chiefs.
The big thing for us is this is not a lot different than, we're at the peak of flu season right now. So for us, it's making sure we're deconning our equipment very well. IU Health has instituted a policy with 911 dispatch so that we're pre-screening people that have signs and symptoms of coronavirus or flu, so that alerts the emergency responders and gives us a heads up about potentially walking into a situation where we could be exposed to this.
He says that kind of communication is crucial.
If we think you have it, we can give you a mask, we can mask up, provide extra, protections for our employees. But realistically, everyone has to kind of do their part to prevent something like an illness like this becoming an actual pandemic.
He also encourages people to share information with the 911 dispatcher.
And the more that we know before we get there, the better equipped we will be to not only help you, but also to prevent ourselves from getting sicker and again, being unable to help other people.
Moore says he knows outside influences can affect his department and others. Emergency workers have lives outside of their jobs.
We do have internal discussions about, what will happen if all the schools are now closed, and, we're working parents as well. So, what would that look like with staffing and everything else?
He says he would be able to call in off-duty firefighters from his 100-person staff if needed to fill in for others who couldn't come to work for one reason or another. For Indiana Newsdesk, I'm Bob Zaltsberg.
The state's EMS medical director says 75% of EMS provider agencies have adequate levels of personal protective equipment. The governor signed an executive order this week allowing retired EMS personnel to return to service.